If you're over 70, you probably think getting more health tests is always better. But what if I told you that some of these common tests might actually do more harm than good? In today's video, we'll explore 5 health tests that doctors often avoid in seniors, not because they're unimportant, but because they can sometimes hurt more than help. Red Circle, this isn't medical advice. It's a deep dive into what many top geriatricians are now recommending to help older adults live smarter, longer, and healthier. Chapter 1. The Hidden Dangers of Overdiagnosis. Visual. Split screen showing MRI scans and a confused elderly patient. Before we dive into the 5 tests, let's quickly understand why more testing isn't always better after 70. Magnifying glass tilted left overdiagnosis is when a test finds something that isn't dangerous, but still leads to more testing, treatment, or even surgery. Woman health worker for older adults, some abnormalities are just part of aging. Yet, once discovered, doctors often feel pressured to treat them, even when the risks outweigh the benefits. Side effects of unnecessary testing include false positives leading to fear, invasive follow-ups like biopsies or surgery, exposure to radiation or harmful procedures, unneeded medications, and hospital stays. The goal after 70 isn't just finding problems, it's protecting your well-being and avoiding preventable harm. Now, let's get into the 5 health tests many seniors should think twice about. Chapter 2. Full-body CT scans, the illusion of safety. At first glance, full-body CT scans sound like a dream. Scan everything, find every possible problem, stay one step ahead. But here's the harsh truth. Prohibited after 70, full-body CT scans are more likely to cause harm than help.
Why?
1. Radiation exposure. CT scans expose you to 100 to 500 times more radiation than a chest X-ray. Radiation accumulates over time, increasing your cancer risk. 2. Incidentalomas. These are small findings like benign tumors, cysts, or nodules that are common in seniors, but not dangerous. Still, they lead to more scans, biopsies, surgeries, all of which carry real risks. 3. No proven benefit. Research shows full-body scans don't improve life expectancy or quality of life, especially for older adults without symptoms. Man health worker, most responsible doctors avoid ordering full-body scans unless there are very specific symptoms. Bottom line, unless your doctor has a strong reason, avoid full-body scans as a routine checkup after 70. Chapter 3. PSA tests for prostate cancer, a risky gamble. The PSA test measures a protein that might signal prostate cancer. For decades, it was routine for men over 50. But here's what doctors have learned. Magnifying glass tilted right, most prostate cancers after 70 are extremely slow-growing and never cause symptoms. Yet the PSA test often leads to painful biopsies, radiation or surgery, impotence or incontinence, psychological stress. Bar chart studies show that PSA testing in older men doesn't improve survival, but increases the chance of harmful side effects. Direct hit experts at organizations like the U.S. Preventive Services Task Force now recommend against routine PSA screening after age 70. There are exceptions. A family history of aggressive prostate cancer, urinary symptoms. But in most cases, watchful waiting or active surveillance is smarter than aggressive testing. Chapter 4. Colonoscopies after 75, the line doctors won't cross. Colonoscopy is one of the most uncomfortable and risky procedures seniors undergo, and many do it unnecessarily. Stop sign after 75. Most doctors recommend stopping routine colon cancer screening.
Why?
1. Prep dangers. You need strong laxatives the day before, which can cause dehydration, confusion, falls, heart or kidney issues. 2. Risk of the procedure. Sedation can affect memory. The scope can cause internal bleeding or even a perforation in the colon, a medical emergency. 3. Slow-growing cancer. Colorectal cancer typically takes 10 to 15 years to grow. If you're 75 plus, the chances are high you'll never suffer from it even if you have early-stage growths. Light bulb alternative. If you're still worried, ask for less invasive tests like FIT, fecal immunochemical test, A simple stool test done at home. Prohibited but routine colonoscopies after 75? Often more dangerous than helpful. Chapter 5. Mammograms in women over 75. A controversial truth. Mammograms are valuable, but after a certain age, they become controversial. Here's why. Magnifying glass tilted left after 75, there's no strong evidence that mammograms reduce mortality. Chart-decreasing breast cancer in older women is often slow-growing. And like prostate cancer, it might never cause harm in a person's natural lifespan. But the test can still lead to false positives, painful biopsies, mastectomies or radiation, emotional distress. Stethoscope. Some top geriatricians now individualize the decision. If you're in excellent health and have 10+ years of life expectancy, maybe continue. But if you're dealing with other serious illnesses, stopping mammograms might be the wiser choice. Talk to your doctor, not your fear. Chapter 6. Bone density tests. DEXA. After 80, more pills, not always better bones. DEXA scans check for osteoporosis, the thinning of bones. But after 80, many experts question their value. Here's the concern. Even if the test shows bone loss, the treatment often involves bisphosphonate drugs, which come with severe jaw issues, esophageal irritation, bone fractures from long-term use. Paradoxical. Old woman. Most fractures in older adults happen from falls, not bone density alone. White heavy checkmark. Better than testing? Balance exercises.
Vitamin D.
Fall prevention at home. Gentle weight training. Pushpin for very elderly women or men with no fracture history. DEXA scans usually change nothing, except putting you on meds you might not need. Chapter 7. What you should focus on after 70. Now that we've seen what not to do, what should you focus on? White heavy checkmark 1. Functional health checks. Can you walk a block? Climb stairs? Get up from a chair? These predict longevity more than scans do. White heavy checkmark 2. Cognitive screening. A short memory check can help identify early signs of dementia and keep your mind sharp. White heavy checkmark 3. Blood pressure monitoring. High or low pressure can cause strokes or falls. White heavy checkmark 4. Vision and hearing. Poor sight or hearing leads to isolation, falls, and memory issues. White heavy checkmark 5. Medication review. After 70, fewer meds are usually safer. Ask your doctor to deprescribe unnecessary ones. Chapter 8. How to talk to your doctor about stopping tests. It's not easy to question decades of medical advice, but your doctor should respect your right to say, "Speaking head, is this test really necessary at my age?" Speaking head, what happens if we don't do it? Speaking head, will the results change how we treat me, or just cause worry? Many doctors quietly agree, but need your permission to stop unnecessary tests. This is called choosing wisely. It's a global movement that promotes smarter, safer care. Chapter 9. The peace of saying no. Saying no to tests doesn't mean giving up. It means you value your time, comfort, and peace. Trust your body, your age, and your wisdom. Choose a life of less fear and more freedom. You've earned it. If you're over 70, it's not about doing everything possible. It's about doing what truly matters. Stop sign. These 5 tests might seem helpful, but they often lead to stress, harm, and no real benefit. You deserve better than that. Subscribe for more life-changing health tips for seniors, and share this with someone you love. Older adult, because living long doesn't matter, unless you're living well.